Hello, I am presenting our research project Disability in the Siege, an analytical framework for a disability-inclusive recovery from COVID-19. I am Vera Cabenz from the University of Birmingham and work on this project alongside my colleague Professor Dina Kiwan, who is a Professor of Comparative Education at the University of Birmingham. Our project is part of a wider project looking at education for disabled children in conflict-afflicted settings, but this particular aspect of our work is a 15-month project funded by the UK Arts and Humanities Research Council. We are investigating the impact of COVID-19 on disabled people in low and middle income countries, LMICs, to compile evidence on what a disability-inclusive recovery from the pandemic may look like. We are working with the UN Partnership for the Rights of Persons with Disabilities, UNPRPD, to translate our findings into policy practice. The project consists of two stages. The first stage was a comprehensive systematic literature review on the impact of COVID-19 on disabled people in LMICs, reviewing in detail 112 research papers and grey literature reports from NGOs, governments and disabled people's organisations. We are now in stage 2 of the project, where we are developing an analytical framework for the UNPRPD. The framework will enable policymakers and development agencies to carry out a situational analysis to understand the impact of COVID-19 in a specific country. This allows policymakers to develop a strategy for a disability-inclusive recovery. We are also working with an advisory group of disabled people from LMICs to ensure our work reflects their priorities, and are coordinating a network of 8 country-specific case studies on disability in COVID-19 to integrate both their findings and methodologies into our framework. Moving on to some of our key findings, which we have organised into 4 sectors. In the health sector, we have found evidence of widespread discrimination against disabled people in accessing COVID-19 related care. This includes triage protocols that deprioritise disabled people based on biased assumptions about their quality of life. Many also struggle to access other routine and emergency care. Health information was often inaccessible with no captions or sign language interpretation. Emerging evidence shows a significant worsening of mental health among both disabled and non-disabled people. In education, around half of disabled children were already excluded from school prior to the pandemic, and this was exacerbated by the move to remote learning. The 2 main barriers to remote education were access to technology and the accessibility of technology, meaning disabled children are falling further behind. Evidence from previous emergencies shows that many stay permanently out of school. In the economic sector, there has been a significant increase in poverty, and particularly food poverty, among disabled people. Relief measures by governments were often short-term and inadequate, and sometimes actively excluded those already in receipt of disability benefits. Disabled people are more likely to be unemployed or work in an informal or insecure employment, a sector that was particularly badly affected during the pandemic, again exacerbating poverty. Finally, disabled people living in the community face significant disruptions to care arrangements due to lockdowns, with many not getting their basic needs met. Infrastructure barriers and disruption to public transport made it difficult to get access to essential items such as food and medicine. Around the globe during the pandemic, human rights abuses have been recorded against disabled people incarcerated in institutions, as well as prisons, refugee camps, and among the homeless population. Stigma and violence against disabled people has intensified in some communities, with disabled people being blamed for the virus and safeguarding mechanisms disrupted. I will conclude this presentation by talking about the key recommendations that we will be building into our framework for a disability-inclusive recovery. Firstly, that it is crucial to involve disabled people in all planning processes to ensure disability is considered in all measures taken in the spirit of the global disability rights motto, "Nothing about us without us." Much writing about disabled people still has a strong medical focus and frames disability negatively, but our research has shown that disability is very much a social justice issue, so it is important to take a social model approach to consider how systemic barriers and discrimination contribute to disabled people's oppression during the pandemic and beyond. There are still a number of evidence gaps where further research is needed, particularly priority access to vaccination for disabled people at higher risk from COVID, and empirical data in all sectors, for example infection and death rates, education dropout rates, and unemployment and poverty figures. It is crucial that data gathered by governments is accurate, consistent, and can be disaggregated by disability status. Finally, the pandemic has exposed many of the underlying systematic issues faced by disabled people. Disability has often been an afterthought in development initiatives, but there's a strong need to focus on longer-term, sustainable development of infrastructure, rather than going for quick fixes that address problems in isolation. You can find more about our research and read the full literature review on our website, which is linked from our WPRN project record. Thank you for taking the time to watch this presentation.